Well, as health professionals continue to report high rates of stress and burnout, one Toronto hospital has created an innovative way to support emergency department staff. In 2020, Michael Garron Hospital launched a physician and nurse-led emergency department wellness committee, which helps support the team to be the best they can as they care for patients. Joining us now for more on this is Dr. Brittany Cameron, emergency physician and co-lead physician of wellness at Michael Garron Hospital. Dr. Cameron, appreciate the time this morning. This launched in 2020. Was this because of the pandemic, or was this something that you just had planned out and it happened to time out at a particularly stressful time at the hospital?
Absolutely. So this did begin at the height of the pandemic in early 2020, and it was really a consequence of the stress and the impact that the pandemic had on our clinical teams. Of course, this was a really high stress time marked with a great deal of clinical uncertainty. So we saw an opportunity not only to try to enhance the care that we were providing for patients in our community, but also to bolster support for our teams, given some of the emotional fallout they were feeling at the time.
Yeah, I can remember some conversations I had with Dr. Michael Warner throughout the pandemic, Dr. Cameron, and some of them stay with me, the ones on air and even off air, just what your doctors and nurses were seeing, day in, day out at the peak of the pandemic here. So with all of that in mind, was it something that doctors and nurses and the other medical staff there, did they embrace it right away? Were they getting to it and finding it helped? Or was there a bit of, well, I don't want to admit that I'm sort of struggling with, stress or, anxiety about all this?
I think we recognized quite early that healthcare teams needed more than PPE, personal protective equipment. They needed emotional support and psychological safety. And so this program really started small. Initially, among our physician group, we introduced a peer support program where we paired more junior physicians with more senior staff. And this was really just a point of contact, recognizing that individuals were facing extreme challenges in the department and may need a source of support outside of their families and friends at home. And from there, we expanded the program to support our nursing colleagues. We brought nursing team members on board, and we've really expanded the offerings that we provide within the department based on evidence.
Interesting. It's interesting, from a lot of first responders, we hear police officers, firefighters don't like to admit that they're struggling with what they've seen and what they've dealt with, in their line of work here. Is it a similar feeling in the healthcare profession that people are maybe they don't want to admit it, or were they very willing to say, hey, yeah, I am struggling. I need this. This is something that's going to help me?
I think the culture is really shifting. That was, those are extenuating circumstances, and individuals needed to reach out in order to provide better care for patients in the community. And so we do see the culture shifting in medicine, and it's certainly something that we try to target, is recognizing that the more open we can communicate with one another and express the challenges we're facing, the better we'll be able to function at work and at home as well.
I was going to say, it seems kind of circular, Dr. Cameron, the fact that if the caregivers are being cared for, feel cared for, and getting the care they need, that helps them in their personal lives, that helps their patients and everybody they're dealing with. It's kind of like a complete circle, isn't it?
Absolutely. So when we invest in the well-being of our teams, we strengthen the entire system. This leads to better care for our patients, and it's a healthier future for our workforce as well.
And I also understand, Dr. Cameron, that other hospitals, whether in the GTHA or beyond, are sort of looking at this, embracing this, and maybe starting up their own similar kind of programs?
Absolutely. We're seeing a lot of development across the city and across the University of Toronto, particularly in emergency medicine related to wellness program offerings. And as the co-lead of our program, I liaise with leads at other sites as part of our academic wellness collaborative, which is led by the University of Toronto.
And so how has your program changed or evolved over the last 5 years? I mean, I realize COVID is still around, but we're certainly far from the peak of the pandemic. How has it evolved, in the last couple of years versus, the intensity of those, couple of years of COVID?
So the emergency department remains a high-stress, fast-paced environment. And so we've tried to innovate and incorporate programs that really support our teams and some of the challenges that they face. This involves, in addition to our peer support program, we do have a critical incident debriefing program. So this allows us to kind of step in when there's been a critical incident or tragic event in the department and liaise with team members, provide support. It's not meant to debrief the clinical events. It's meant to provide more of an emotional support in follow-up. And so that's a program that I oversee with a physician colleague and 2 of our nursing leads as well.
Okay, Dr. Brittany Cameron, appreciate your time this morning and, of course, the work you do every day. Thanks for the time here. Take care.